Definitely, this is very hard topic for the moment. We are at the moment of the success of total neoadjuvant treatment in rectal cancer. This success is driven by several studies. Everything started with the Polish 2 study, which has been already reported more than 7 years ago, and was confirmed in studies coming from UK, France, and US and China. But there were no international studies. And all these studies show something interesting, that early chemotherapy before surgery of rectal cancer may lead into benefit in limiting the number of metastatic diseases afterwards. But there is no strong data that it will lead to the local disease control, meaning the control of disease in the pelvis. There are different strategies which can be distinguished by 2 points. One of this is dosing and fractionation of the radiotherapy. In studies coming from Poland or from UK, the short course radiotherapy, which consists of 5 fractions on 5 consecutive days, was assessed, while in studies from US or France, long course chemoradiation consisting of more than 5 weeks of the treatment before we start chemotherapy was given to these patients. These 2 strategies leads to slightly different outcomes, but they were never compared in any international study. So definitely we need real-world evidence for the optimal total neoadjuvant treatment, and we need a guidance which patients could benefit the most on the one side, and clear statements which patients should not be treated with total neoadjuvant. Total neoadjuvant is a half a year of the treatment, which leads the patient with subsequent chemotherapy toxicities. There is a recent data coming from ASCO this year indicating that in some situations we may even omit the radiotherapy, although this data should be treated with a caution, since the US approach included the half of the population in that study, which in Europe would not be exposed to radiation at all. So we have now nationalization of treatment strategies coming from UK, France, or US, and we are missing the international cohorts and clear guidelines or statements which patient populations would benefit the most.